Big changes are coming to Medicare, and for some of you, this could mean reevaluating your entire plan. Plus, there's been a major data breach that affected nearly 1 million Medicare recipients and a huge surge in billing scams that may have a big impact on your bottom line. Let's break down what you need to know and how you can stay safe. I'm Nicole from Low Income Relief, and today we're going to talk about some important updates that could impact your Medicare coverage, especially if you're on a fixed income. We're going to cover key changes, potential scams, and how to protect your benefits. Now, before we get started, I just want to know, have you had to reevaluate your Medicare plan this year? Let us know in the comments. I really want to know how these changes are impacting you, because I know a few weeks ago, we talked about how more than 500,000 Americans would be losing their Medicare Advantage plans this year. That's more than 10% of people on Medicare Advantage, which means that many people are going to have to make major changes. If that's you, I want to make sure that you're able to understand your options. So a good starting point is the official Medicare and You 2025 handbook. It outlines all the changes that are coming to Medicare next year, and it's available right now. You can download it at medicare.gov. Make sure to take a look because it is packed with all sorts of useful information. Of course, I know that reading through a 125-page booklet is a lot, and it can be really hard to understand. So, according to Kiplinger, there are 3 major changes that you should know. First, if you're on Medicare Part D, you will no longer pay more than $2,000 in out-of-pocket costs for covered medications. That's great news for anyone with expensive prescriptions. Second, if you have a Medicare Advantage plan, you're going to start getting a special notice in July of 2025. This letter will outline any supplemental benefits that you haven't used yet and what it takes to start using them so that you can more easily take advantage of the benefits that you're entitled to. We've noticed over the years that a lot of Advantage plans advertise big, flashy perks that a lot of times don't actually get used. So I think this notice will help you access those benefits more easily. And lastly, this is the change I'm most excited about. Medicare is taking steps to limit sales incentives for Medicare plans. Salespeople often get big bonuses for steering you towards certain plans, and that means that sometimes their recommendations are based on what's good for their wallet and not necessarily what's good for yours. With the new caps on these bonuses, I'm hoping that we'll see more honesty in this process. And of course, you can always call your state health insurance assistance program for impartial guidance on what Medicare plan is best for you. You can get started with that at shiphelp.org. You might want to write that down, actually, because open enrollment season is coming up in just a few weeks, and that's when everything starts to get really confusing. Ads will start flooding in around October 1st, and they run through early December, and every year we see misleading promises like free grocery cards or stimulus checks or all sorts of nonsense. So it's important to stay vigilant and carefully evaluate what you can trust. We're working on another video about how to evaluate those options during open enrollment. Make sure that you're subscribed to our channel so that you don't miss that. It's packed with all sorts of tips that will keep your benefits safe. For now, though, we need to talk about something serious. The Centers for Medicare and Medicaid Services recently notified nearly 1 million Medicare beneficiaries that their personal data was exposed in yet another security breach. This happened because a contractor, WPS Insurance Corp., used a vulnerable file transfer software back in May of 2023. Unfortunately, your personal information like your name, address, birthday, social security number, hospital account numbers, dates of services, and even your Medicare claims data may have been compromised. I'm going to tell you why that last one is such a big deal in just a few minutes, so make sure you stay with me. At first, WPS didn't think that anything had been affected, so they didn't say anything. But a year later, in May of 2024, new information came to light, and no one has said exactly what that is. But after a more thorough investigation, they realized that someone had accessed and copied those files before they patched the security hole. CMS was notified on July 8th, 2024 that something had gone wrong, and now they're reaching out to everyone who's been affected. And like I said, there's almost 1 million people who are impacted by this. And here's what they're offering to help. They're offering 12 months of free credit monitoring to anyone who was affected, and they're also going to reissue new Medicare cards with a new Medicare beneficiary identifier number for those who were impacted. Now, of course, this doesn't completely fix the problem. There are still some steps that you will need to take in order to get through this safely. And the first thing you need to do is watch out for official communication from the Centers for Medicare and Medicaid Services, or CMS. If your information was exposed in the breach, CMS will send you a letter to notify you. It's very important to remember that they are going to send you a letter, not a phone call, not an email, and definitely not a text message. So if anyone reaches out to you by phone, email, or text claiming to be from CMS about the breach, that is a red flag. Scammers often use situations like this to prey on people, so be very cautious. If you receive anything that feels suspicious, hang up or delete the message. Because there's one more thing to note here. If you're unsure whether communication is legitimate or not, check the sender carefully. Official letters from CMS will have their seal and clear instructions, while scammers often use vague language, high-pressure tactics, or requests for your personal information right away. It's better to be safe and verify any correspondence directly with CMS if you have any doubt. Second, you need to monitor your credit closely, especially if CMS offers you free credit monitoring services. In today's world, data breaches are unfortunately becoming more and more common, so it never hurts to have this set up so that you'll be notified if anyone tries to use your personal information. Of course, I personally recommend signing up for Delete Me as well. I've used it for years to keep my personal information off of the web, and it works wonderfully. You can get a 20% discount on your service when you sign up using my affiliate link at lirlinks.com/DM if you're interested. Now, another thing to watch out for is anyone who contacts you saying that you need a new Medicare card or tries to charge you for it. CMS is going to automatically send out those new Medicare cards with new Medicare beneficiary identifier numbers to anyone who was affected by the breach. You do not need to do anything to get your new card. It will come automatically, free of charge. If someone calls you, emails you, or texts you saying that you need to take action or pay to receive it, that is a scam. Scammers often try to sound official and may even ask you to confirm your Medicare number or other sensitive details. They may try to make you feel like you need to act urgently or you're going to miss your opportunity. But remember, CMS does not act that way. They will not ask you for this information over the phone, by email, or by text. If you ever have any doubts, please reach out to them directly to verify. And I know I keep saying that, but I seriously cannot stress this enough because so many people fall for these tricks and it never ends well. The next thing you need to do is take a close look at your Medicare summary notices. These are the statements that you receive every so often that detail any services or supplies that have been billed to Medicare in your name. If you see anything you don't recognize or charges for services that you didn't receive, that could be a sign that someone is using your benefits fraudulently. It can be easy to overlook these documents, right? It's just easy to ignore mail. But it's worth taking the time to carefully review each charge. Sometimes the fraud is subtle, an extra service here, a little upcharge there, maybe something you never ordered. But if you see something that doesn't add up, you need to call Medicare right away at 1-800-MEDICARE or contact your state's Senior Medicare Patrol for assistance. These trained professionals are there to help you spot and resolve any fraud or discrepancies that you find. Now, finally, if you have any questions or concerns, seriously, do not hesitate to contact Medicare directly at 1-800-MEDICARE. That's why that hotline exists. Now, if you prefer, you can also visit the official Medicare website at medicare.gov. They do have a lot of helpful information and tools there if you're comfortable using them. If you go that route, just make sure that you're using the official medicare.gov website and not some third-party site pretending to offer Medicare services. There are plenty of those out there too. So, have you received a letter from CMS about the breach yet? If you have, leave a comment and let me know because I'm definitely worried about you. Now, unfortunately, that data breach isn't the only thing I'm worried about either. In recent months, we've seen a surge in Medicare scams across the country, with fraudulent claims totaling over $3.8 billion. These phony claims are being filed under unsuspecting seniors' names, and in some cases, those seniors are literally paying the price. Imagine checking your Medicare statement and seeing thousands of dollars in charges for services or products that you knew nothing about. It's happening more often than you think, and these scammers are getting more and more creative and aggressive in how they target you. CBS News Chicago recently reported on an elaborate scam that has surfaced in several states, including Illinois, Ohio, Hawaii, and Texas. And here's what's happening. Medical service providers like WABA Medical and Konanaya Medical, along with 9 other companies, are billing Medicare for thousands of dollars in products that their patients don't even know about. Around $1 billion of these claims were for catheters, and the seniors that were billed for them don't even use them. So here's an example from WABA Medical in Chicago. Up until December of 2023, they were billing about $8 million in Medicare claims every year. But when new owners took over in January 2024, their claims skyrocketed to over $260 million in just a few months. The kicker? Most of this was for catheters, products that they don't even list as part of their medical services. What makes this even more troubling is that the fraudulent claims seemed legitimate on paper. This is why it's so important for you to carefully check your Medicare summary notes. These notices show what Medicare has been billed for in your name, and reviewing them closely can help you catch fraud before it escalates. Because this kind of fraud has very real consequences for the seniors who are affected. Take Ann Caruso, for example. She discovered $15,000 in fraudulent charges in her Medicare records, most of it for catheters she never ordered or used. While $12,000 of that was covered by taxpayers through Medicare, she's now stuck with an additional $3,100 that was billed to her supplemental insurance. And now she's understandably concerned that her premiums are going to increase as a result of that bill that she knew nothing about. And unfortunately, her insurance provider hasn't responded to anyone's inquiries yet, so she still doesn't know what to expect. Ann's situation is unfortunately not unique either. Another senior named Tom England from Texas found out that his Medicare account had been billed more than $8,000 in catheters by Konania Medical. He didn't use or receive those either. When investigators tried to track down this company, they found nothing but an empty office. These are just a few examples, but they highlight a widespread issue that's happening across the country. If it can happen to Ann and Tom, it can happen to anyone. And that's why it's so important to be vigilant. The good news is that Medicare has been able to stop payment on 95% of these fraudulent claims. And while that sounds like a big success, and maybe you think you don't need to really worry about it, it's still important to realize just how big that 5% is. Even a small percentage of fraudulent claims can add up to big losses. In this case, even a 5% payout means that $190 million in taxpayer money has still been stolen by these criminals. This is money that should be going toward helping seniors access the health care that they need, but instead it's being siphoned off by dishonest companies. It's frustrating, but there are steps you can take to protect yourself and your benefits. So, what can you do? First, carefully review your Medicare summary notes. I know I keep coming back to this, but it is so important. These statements will show you any services or supplies that were billed in your name, and if you see something you didn't order, didn't authorize, or didn't receive, do not hesitate. Call Medicare immediately. Even if the charge seems small or insignificant, it's still worth reaching out. Sometimes scammers will start with a small charge here and there to test the waters and see if anyone's paying attention. And if you don't, they might ramp up their fraud once they think they can get away with it. If you do find something suspicious, call 1-800-MEDICARE to report the fraudulent charges and get advice on what to do next. You can also reach out to your local Senior Medicare Patrol, which is a service specifically designed to help seniors like you combat Medicare fraud. SMP teams are experts at helping you understand and resolve these issues with your billing, and they can help guide you through the process of correcting those fraudulent charges. Don't feel like you have to do this on your own because they are there to help you. You can contact them at 877-808-2468 and then just ask for the number for the office in your state. And of course, if you think your Medicare number has been compromised, you can also request a new number from Medicare as well. So, has your Medicare account ever been charged for something you didn't use? Be sure to double check those statements, and if you've had an experience with this, please let me know. And if you found this video helpful, don't forget to share it with other Medicare beneficiaries you know, and make sure that you're subscribed so you don't miss our upcoming videos on Medicare as well. I'll see you again soon.